Hello, and thanks for joining us today for the Regional Interagency Council, also known as RIAC Orientation. I'm Vanessa Brewer, the RIAC Program Administrator with the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And today I'm going to be presenting this information with Lee Taylor. Lee is the State Interagency Council for Services and Supports to Children and Transition Age Youth, also known as RIAC Program Administrator. And she is also with the Department for Behavioral Health, Developmental, and Intellectual Disabilities. So just a little history. The system of care approach was first introduced in the mid-1980s to address well-documented problems in the mental health systems for children and youth with serious emotional disturbances and their families. And among these problems were significant unmet needs for mental health care, overuse of excessively restrictive settings, limited home and community-based service options, lack of cross-agency coordination, and lack of partnerships with families and young people. And the system of care approach has provided a framework for the reforming child and youth mental health systems nationwide and has been implemented and adapted across many states and communities with positive results. The Child and Youth Family Services administered by the Department for Behavioral Health, Developmental, and Intellectual Disabilities operates in accordance with the National System of Care approach and supports contracted entities to do the same. Kentucky's system of care expansion has evolved similarly to federal changes. The system of care approach focuses on all life domains rather than only the child and youth's mental health and includes the child and family serving agencies, community, and natural supports in order to improve outcomes across domains and overall well-being. It's important to note that the system of care is not a model or a program that can be replicated, but instead it's an organizational framework for creating sustainable system change. Using this framework, RIAC support child and family serving agencies with collaborating instead of operating in individual silos, with viewing youth and family with lived experience as stakeholders as we build the system of care, ensuring that they are involved in the assessment, the planning, the implementation, and the evaluation of system of care efforts, and meeting families and youth where they are, addressing their social, their ethnic, racial, educational, and linguistic needs. And Kentucky is one of the few states with an organized infrastructure focused on the development, the implementation, and the oversight of the system of care. So if you've been around for a while, you know that RIACs have been around for a while too. They were established in 1990 to serve as the gatekeeper of impact services. And as we fast forward through the years, you can see that RIACs have significantly evolved, expanding their aim to a broader population of focus and their focus from an individual approach to a system level approach to support the well-being of all children and youth with or at risk of behavioral health challenges and their families. So to dive a little deeper into the transition of RIACs during this time, rather than focusing on individual needs, RIACs are tasked with promoting the well-being of all children, youth, and transition age youth with behavioral health needs and utilizing local experts to identify services and supports needed to promote the mental health so that all children, youth, and transition age youth can reach their fullest potential. So the mission of RIAC is to promote healthy children and transition age youth across Kentucky. We're building a system of care to promote children's and transition age youth social, emotional, and behavioral well-being where they live, learn, work, and play. One of the main goals of RIAC is to support collaboration among child and family serving agencies and system of care partners, and through those partnerships, increase awareness across sectors of the importance and the benefits of intervening early when behavioral health concerns arise to increase the likelihood of positive outcomes for children and youth of all ages. Also, identifying and addressing problems in high-risk population to optimize mental health for all children and increasing the emphasis across sectors on providing or linking with mental health promotion and prevention. There are a total of 18 RIACs across Kentucky, divided into regions that serve as governing bodies of the system of care. RIACs provide a protected space for collaboration where all participants are welcome and encouraged to provide input or ideas. It's a space reserved to share identified needs and or barriers for children and youth with or at risk of behavioral health needs with the overall goal of supporting better outcomes for these youth and their families. Rather than reinventing the wheel, the structure builds on existing resources within the community to support sustainable policy practice and system reform in order to improve the larger system of care. And just to clarify, RIACs are not responsible for developing needed services as identified by the RIAC, but instead are responsible for identifying service gaps, needed supports, and working strategically with system of care partners to find solutions to the gaps. The RIAC population of focus is youth, children, youth, and transition age youth with or at risk of behavioral health needs and or other behavioral health challenges. And in order to be successful, there are some necessary things that should be occurring routinely at the RIACs and outside of the RIAC meetings. First and foremost, strategic planning. This is the linchpin of regional system reform. Each RIAC should have an action plan that documents everything from the development of the goals to implementation and evaluation. It's the tool that keeps us accountable and moving forward. RIACs also need to be sharing resources across all sectors to be able to connect youth and their families to needed services and supports. When I attend RIAC meetings and I hear discussions about the various resources that are available through agencies and or the community, I often hear participants respond with, wow, I didn't know that that existed. That's going to be so helpful to the youth and families on my caseload. Also, RIAC should be promoting the system of care framework across all sectors and in the community so that all child and family serving agencies align their policies and practices with system of care core values and guiding principles to support optimal outcomes for Kentucky's children, youth, and their families. And we'll dive into what that looks like on the next slide. So the system of care philosophy is built upon national core values and guiding principles. These core values and guiding principles should guide the development, the implementation, the expansion, and the evaluation of the regional system of care efforts. The core values of the system of care philosophy specify that the system of care should be youth and family driven. It should involve families and youth in the decision-making of their own services. It should treat families and youth as equal partners and stakeholders in the identification of service gaps and barriers, challenges, and quality improvement efforts. It should also involve families and youth at the system and the policy level. And youth and or parent reps don't have to be comfortable with public speaking in order to be included on the RIAC. Sometimes it takes a while to get acclimated and to get comfortable. And we encourage the RIAC to be flexible and give parent and youth representatives the option of providing input and chat if the meeting is virtual until they're comfortable with speaking in front of the group, or working with the LRC or the chair to be able to provide their input to the group until they're comfortable. We also want the system of care to be culturally and linguistically responsive. Our system of care should meet families where they are. It should value diversity, understand the differences, and develop services and supports to meet the unique needs of each community. It should be community-based. It should ensure and or support the development of appropriate care options for children, youth, and transition age youth live, so they don't have to leave their community for services. And it should ensure that high-quality services are accessible to families in the least restrictive, clinically appropriate setting as possible. So the guiding principles are how the system of care values are put into practice and or operationalized. So by doing the things that are listed on these slides, we are more likely to ensure the safety, the permanency, and the well-being of children, youth, and their families. So let's talk a little bit about who's at the RIAC table. If you've ever served on a council or a work group, you know that having the right people at the table is crucial to meeting the desired outcomes as defined by the group. And so Kentucky officials recognized this many years ago when they were developing legislation to support the RIAC infrastructure. Per statute, RIACs are supported with representation from the agencies that are listed in the circles on this slide. All of these agencies serve a shared population that includes children and youth with a risk of behavioral health needs and their families. And this overlapping structure supports the philosophy that rather than providing behavioral health services and supports in isolation, services are implemented as natural supports where young people receive services and or where they live, learn, work, and play. In addition to the agencies that are listed on this slide, Kentucky statute supports that parents and transition age youth between the ages of 16 and 25 with lived experience as stakeholders on the RIAC to ensure that parent and youth voice is included in the identification of service barriers and or needs. and in the implementation and the evaluation of regional system of care efforts. Including families and youth with lived experience at all levels of the system of care reform is key to a healthy and successful system of care. And just so you know, you don't have to become a member of the RIAC to participate in the RIAC meetings. Anyone is welcome to attend, whether to learn more about the regional system of care or to provide input on regional needs, barriers, and or on what's working well. We like to know what's working well so that can be replicated in other areas of the state. On this slide right here, we provide the criteria for the RIAC parent representative and the RIAC youth representative. The parent representative must be a biological, adoptive, or relative caregiver with permanent legal custody who is raising or has raised a child with mental health or co-occurring mental health and substance use challenges, who has been or is a client of at least one service to address these challenges prior to the age of 21. The parent rep alternate should meet the same criteria. The youth rep should be a transition age youth between the ages of 16 and 25 who has a behavioral health disorder and who is receiving or has received a service to address mental health, substance use, or co-occurring mental health and substance use disorder before the age of 21. The transition age youth alternate rep should meet the same criteria. And just so you know, employees of the Community Mental Health Center or other RIAC member agency cannot serve in the role of parent rep or parent rep alternate or youth rep alternate. And the reason for this is we want the parent rep and the youth rep alternate with lived experience that serves on the RIAC to be able to come to the RIAC and provide information about their experience in an authentic way. We don't want either what's worked well or what hasn't worked well regarding the services that they receive to impact their employment. And so therefore, that's why this policy exists. All right, RIAC membership. The RIAC may choose to add non-mandated members to the RIAC that represent other agencies or entities that provide services and supports to children and transitioning youth with or at risk of developing behavioral health needs. So this does occur by majority vote of the RIAC. And it's important to know too that any non-mandated members that are added to the RIAC are included in the RIAC's quorum when conducting RIAC business. So a quorum of the council exists if 55% or more of the total members are present. And it's very important to know who your voting members are. And so the quorum tracker is a nice tool to be able to identify mandated members, non-mandated members, and guests for each meeting. And we'll talk a little bit more about the quorum tracker later on in the presentation. But just to reiterate, RIAC meetings are open to the public. Anybody is welcome to attend to learn more about the regional system of care or to share information about services and supports within the community. This slide right here provides examples of some of the non-mandated members and guests that attend RIAC across the state. So again, you don't have to become a member to attend, but you can attend just as a guest if you're interested. And that quorum tracker tracks the information whether you are a mandated member or a non-mandated member or a guest on the RIAC.
So now that you know what RIAC is and who the members are, let's talk about what the members do. First, we want members to consistently attend the RIAC meetings. And if you can't be there, have a consistent alternate person to represent your agency. In addition to consistently attending RIAC meetings, we want members to actively participate. This may look like bring in agency data when it's available to assist the RIAC in identifying service gaps or needs, as well as to support what's working well. We want the RIAC members to help promote data-driven decision-making. When deciding on what the RIAC will focus on, we want the RIAC members to look for data to support that need. It's also really important for RIAC members to use family-centered language. And by that, we just mean non-judgmental language that demonstrates value and respect for those we serve. We want the RIAC members to be involved in RIAC's action plan activities. As you're going through working on your action plan and noting activities, jump in and volunteer for one of those activities. We want the RIAC members to bridge your agency's work with the RIAC to promote system level change that Vanessa talked about. And then as you learn more about the system of care, core values, guiding principles, we want you to take that back to your agencies as well as other community members. We encourage all agencies to follow the system of care core values and guiding principles. This slide lists some of the important items that RIAC members vote on when there is quorum. The RIAC members decide the RIAC's area focus, as well as the action plan, goals, objectives, and activities. This means that the RIAC members decide what the RIAC is gonna do and where it will spend its time and resources. We'll go into more detail about that just a little bit later in the presentation. If there are funding opportunities, the RIAC members decide if the RIAC will apply and what will be included in that proposal. Members decide who will chair the RIAC, as well as the term of the chair. RIAC members vote on parent and youth applications, as well as adding non-mandated voting members. Every RIAC in the state has a standard template of required policies and procedures that's required for every RIAC. RIAC members can decide if you want your RIAC to add additional policies and procedures to meet your RIAC needs. Each month, RIAC members vote on the prior month's RIAC minutes and adjournment, and RIAC members vote on RIAC's budget. The form that you'll hear most often, we call Form 131, and on that form, you'll see funding amounts for things like parent and youth participation on the RIAC and activities related to the RIAC's action plan. That's a very broad description of Form 131. We have a recorded training that we recommend for a detailed explanation, and that can be found on the RIAC Learning Series YouTube channel. So what does it mean when RIAC members vote? The RIAC as a group brainstorms, discusses, and then votes using Robert's Rules of Order. So a voting member, either mandated or non-mandated, would make a motion. Another would second the motion, then the RIAC chair calls for a vote. Each item listed on this slide requires a majority vote to move forward. Next slide. Each RIAC has 2 leaders and they work as partners for the RIAC. The local resource coordinator is known as the LRC and is often the first face that you think of when you think of a RIAC. The LRC is employed by the Community Mental Health Center and is staffed to the RIAC. This means that the LRC is the RIAC's content expert on RIAC policies and procedures, and they provide a lot of technical assistance, which we'll cover more on the next slide. The chair is voted in by the RIAC, and we have a slide with more details in just a moment. There is a lot of information on this slide, and that is because the LRC has significant duties to the RIAC. The LRC coordinates the work of the RIAC and provides technical assistance to the RIAC members. Each month, when the RIAC members work on the action plan, the LRC is responsible for updating that plan. The LRC drafts the meeting minutes, creates the agenda with the help of the RIAC chair, and then the LRC sends those meeting reminders with those documents and the updated action plan at least 1 week prior to the RIAC meeting so members can come prepared to the meeting. When meeting virtually, the LRC sends the meeting link also. While it should be sent at least 1 week prior, we also recommend going ahead and sending calendar invites for the whole calendar year so that members have that time reserved on their calendars. The LRC is a system of care champion. The LRC shares information and community resources and provides system of care training as necessary. The LRC also provides the RIAC orientation for all RIAC members initially and then on an ongoing basis. The LRC uses the quorum tracker that Vanessa referenced to capture member attendance, and we'll show a quorum tracker here in a little bit. And the LRC serves as the content expert for RIAC policies and procedures, knowing where to find the information if they don't already have it. The LRC also monitors the budget and shares the forms with the RIAC. After the RIAC votes on the budget, the LRC signs off on those forms. And then it's also the role of the LRC to ensure a mandated member of RIAC attends fair team meetings. Youth are the one excluded member from fair team participation. And there is a RIAC fair team guidance document that was created to explain more about those fair team requirements. Ultimately, the LRC is responsible for meeting all the LRC contract deliverables, which are listed in the contract between the Community Mental Health Center and the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And just a quick reminder that the LRC is staff to the RIAC and not a member, so therefore they don't have a voting voice. The chair can be any member of the RIAC selected by majority vote. If a chair leaves their agency position, the chair role is not automatically assumed by their alternate or the next person that attends RIAC from their agency. The RIAC would again vote for a chair. The chair partners with the LRC to champion system of care efforts, working with the LRC between meetings to plan the agenda. The majority of the work of the chair occurs during the actual RIAC meeting. The chair facilitates the meeting and encourages the RIAC members to be actively involved in discussions and activities. The RIAC chair should remain neutral in the discussion. It's really important that the RIAC leads all decision making, the RIAC body as a whole. The chair ensures meetings are effective, purposeful, and fair, and follows Robert's Rules of Order. The chair does not make motions or seconds, and they only vote when a tiebreaker is needed. Along with the LRC, the chair is expected to attend RIAC meetings consistently. In addition, they attend quarterly RIAC leader peer group meetings and attend SEAC meetings quarterly at a minimum. The LRC provides the Form 131, and then the chair reviews that with the RIAC, and that happens at least 3 times per year. The form is due to our department with plan and budget in April, and then semi-annually January 31st and July 31st.
All right, so let's talk a little bit about RIAC duties. Once again, if you have ever served on a council or a work group, you know that having established expectations or task is just as important as having the right people at the table if you want to achieve those desired outcomes. So Kentucky officials also recognized this years ago and incorporated RIAC duties into statute. So per statute, RIACs are primarily responsible for conducting regional system of care planning and operations by working together to identify service gaps and or barriers for children and youth across agencies through ongoing regional and or local needs assessments. This doesn't have to be fancy. It's simply a process for collecting information used to determine the needs, the gaps, and or barriers. And once you have this information, allowing the RIAC to use it to build community support that might be needed to address the desired changes. Also, coordinating system level continuous quality improvement by routinely reviewing relevant local, regional, and state level data to evaluate and strengthen the regional system of care. RIACs are also responsible for identifying and developing ways to support system of care expansion opportunities, such as through grants or support from system of care partners like managed care organizations or collaboration with agencies to bridge service gaps and or increase access to services. Sometimes it takes getting really creative. RIACs are also responsible for educating others about the system of care approach and why it's important to implement this approach into their policies and practices. This includes RIAC member agencies, community partner schools, etc. Really anyone that works with youth and families. Additional duties of the RIAC include ensuring bi-directional communication between the RIACs and the SEAC is occurring regarding what's working well that could be potentially duplicated in other regions, or to seek support from SEAC when identified needs and or barriers cannot be addressed at the regional level. And lastly, ensuring collaboration between RIACs and the FAIR teams to support resource sharing and or solution-focused discussion around identified barriers.
So we're going to spend a couple of slides talking about the State Interagency Council for Services and Supports to Children and Transition Age Youth, again known as SEAC, and its connection to the RIACs. The SEAC serves as the governing body for the state system of care. It was created in legislation in 1990, and per KRS 200-501, the intention is to build on the existing resources and to design and implement a system of care for children, transition age youth with or at risk of developing behavioral health needs. that is community-based, family and youth-driven, and culturally and linguistically responsive. You'll recognize those as system of care core values, and those are written into state law that SEAC follows those. SEAC's population of focus is the same as RIAC's. It's children and transition age youth. That includes ages 0 through 25 with or at risk of developing behavioral health needs, and that includes mental health, substance use, or co-occurring mental health and substance use. SEAC membership is also mandated by statute. Membership consists of commissioners and executive director leaders from 12 state agencies across 5 cabinets that serve children, transition age youth, and their families, as well as a nonprofit family organization, a youth representative, parent representative, and the chair of the Subcommittee for Equity and Justice for All Youth, which we call CJ. SEAC duties are outlined in statute as well, and we'll see those on the next slide. So as the governing body for Kentucky System of Care, SEAC is required to assess the effectiveness of RIACs and their role as the governing body of the regional system of care, which were outlined in the RIAC expectations. And just a quick reminder that serving as the governing body of the regional system of care means identifying service gaps, needed supports, and working strategically with system of care partners to find solutions to the gaps. So what does that look like? As the RIAC and SEAC administrators, one of Vanessa's and my primary duties is to assist in bidirectional communication between the state and regional interagency councils. One way we do this is by attending RIAC meetings as often as possible. When in person, that looked like 1 to 2 visits per RIAC per year, and virtual allows us to attend much more frequently. Vanessa and I create a calendar and work out our schedules so that we can attend as many as possible. Between the two of us, we are able to cover almost every RIAC meeting. Our duties in those meetings are to provide technical assistance and support around policies and procedures, legislation, and the system of care core values and guiding principles. We provide coaching and support in the development of the RIAC's action plan, and upon a request, we can facilitate a brainstorming session and assist with transferring the ideas onto a RIAC action plan. We also ensure that the RIACs are implementing and updating their action plans monthly, and then share what's occurring at the state level. The other half of bidirectional communication is sharing with SEAC what's occurring at the regional level. Vanessa attends SEAC monthly and shares with SEAC approximately quarterly regional level successes. And then per SEAC policies and procedures, Vanessa provides a monthly summary report to SEAC that includes each RIAC's area of focus, current activities, successes and identified needs, and regional system level barriers. This helps SEAC know when there are system level barriers that need to be addressed at the state level. Most recently, Vanessa added Kentucky 6 RIAC supported activities, and Vanessa will talk about that a little bit later. This monthly report template is on the RIAC Leaders Google Drive, and the LRC fills it in each month. Vanessa finalizes that report and then makes sure that it's submitted monthly. It is available to all RIACs via your RIAC leaders, your LRC, or your chair, and it's also shared with SEAC and the SEAC listserv monthly. This means that your RIAC's actions, activities are shared with hundreds of people statewide every month.
All right, so we're going to dive a little deeper into RIAC accountability to show some examples of what this looks like for RIACs and on a statewide level. So this is a picture of the RIAC Fidelity Monitoring Tool. So this was designed by RIAC leaders and department staff to assist RIACs with ensuring regional system of care efforts align with statute, with RIAC policies and procedures, and Kentucky's system of care framework. This is a tool that Lee and I use when we attend RIAC meetings. And we use the information that we gather to inform TA that we provide to individual RIACs and to RIACs across the state. This isn't a pass or fail system. It is really just a tool that helps us to document what the strengths are and where there are opportunities for growth. Our hope is that RIACs are using this too to observe what is occurring in their meetings on a monthly basis. Not that this tool has to be used monthly. It can be used at the RIAC's discretion, monthly, quarterly, whatever suits them best. But we do hope that they are also using this tool to be able to assess strengths and opportunities for growth.
The next tool that we use for RIAC accountability is the RIAC Quorum Tracker, which you've heard us reference a couple of times. Our department developed this to support RIACs in tracking attendance, identifying alternates, and keeping track of mandated and non-mandated members, as well as guests. As of January 2024, it is a requirement that RIACs utilize this to track attendance every month, as well as quorum, and then those get submitted to Vanessa. If you take a look at this form at the very top, it explains what quorum is so that you know what that means and what to look for every month. The first top section is the list of all of the mandated members. That second section is the non-mandated members, which means they attended at guests at some point and then were voted in as members. The non-mandated members do count towards quorum. At the very bottom of the quorum tracker, you'll see non-voting and guests. Anyone else that attends the meeting gets listed there, including the LRC, because like we talked about, they're not a mandated member. Those do not get counted towards quorum. And then right above that, you'll see parent and youth supporters. This does not have to be a separate individual in your RIAC. However, it can be. They're not mandated. They're not non-mandated. They're two people, maybe one, that has agreed to provide support to the parent representatives and the youth representatives. And by give support, like you may be texting or direct messaging the parent or youth rep during the meeting to explain any acronyms if they get used in the meeting. It may be that they reach out to you in between meetings, asking for a reminder about the next meeting or asking you to explain something that happened to a meeting. The parent and youth rep supporter can be anybody that wants to do that. It is very important that they attend the RIAC meetings so that they can fully be helpful to the RIAC parent and youth reps.
And this tool is also used to compile the information that goes into the biannual RIAC attendance report that is submitted to SEAC twice a year. So this is something that RIACs, once completed, submit to me. And again, that information is compiled into one big report and shared with system of care partners across the state. All right, so another measure of accountability is the contract monitoring tool. So this tool right here includes the deliverables between the community mental health center and each community mental health center and the state. I've got it on this slide so you can see it a little bit better, but these are the deliverables that are measured quarterly. Because the LRC is staffed to the RIAC, it is the LRC that is responsible for ensuring that these deliverables are met, but it is ultimately the responsibility of the RIAC to work together to ensure that these deliverables are met. You'll see here that we've got some reporting ones too that do include submission of the action plan, the RIAC meeting minutes, and then again, Form 131 that Lee had talked about a minute ago. This is the RIAC monthly report that Lee mentioned earlier. This is the report that RIACs are responsible for updating on a monthly basis. They are to provide updates relevant to the action plan that support their goals and their objectives and their overall area of focus. We also ask on this tool that they provide updates to Kentucky 6 activities that are required to be listed in their action plan. We also love to hear when things are going well. So we've got an area on here for success stories. And then you'll notice towards the bottom of this area here, we've got identified needs, barriers, and trends. So if there are challenges that the RIACs are facing, for example, if they're having challenges with getting all of their mandated members there, this is the space for that right here under RIAC. The fair teams, if there are trends that are being observed on the fair teams for children, youth, and or transition age youth with at risk of behavioral health needs, we want to know what those trends are so that that can be brought back to the RIAC for solution focused discussion. And of course, any regional system level barriers would be documented right here.
And I'm just going to summarize a few of the things that we've talked about so far. The RIAC expectations that members are meeting monthly, they're attending consistently, and blocking out that hour and a half to 2 hours each month to meet, and the majority of the meeting devoted to action planning. The RIACs are encouraged to use local regional data from child and family serving agencies to drive the work of the RIAC. And there are also multiple sources of state data that are available as well. Data should be used to determine gaps, needs, barriers, what's working well, what can be expanded to other agencies, communities, or regions, like we've talked about a little bit earlier. As RIACs develop an action plan, they should keep in mind the RIAC population of focus and think about what are their desired outcomes that would create sustainable system change. We encourage RIACs to use evidence-based practices to meet their goals. We don't want RIACs to have to reinvent the wheel. If we know that it works and we have data that supports it, then use it. It's important that the RIAC members are the active voice and decision makers at those meetings. The RIAC's action plan, including the area of focus, the goals and objectives, should be chosen by the RIAC members by majority vote. The activities within the action plan should also match those goals and objectives and should drive the work of the RIAC. We want the action plan screen shared during the meetings and hopefully updated during the meetings. So as you go through it, you can see where the progress is and what still needs to be done. This can be, but does not have to be done by your local resource coordinator. If someone else in the group is more comfortable with screen sharing and typing, anyone can do it. Just email it to the LRC and chair after the meeting. And Vanessa and I are happy to provide support around this if you need to see what that looks like in action. We're happy to coach someone through it or model it at one of the meetings. And when we say action plan, this is what it looks like. On the screen is a template that we've provided for the RIACs. It's available in both Word or Excel, whichever one you're most comfortable with. This should be on the screen during the action planning discussions like we talked about, whether meeting virtually or in person. And everyone should also have an updated copy. Each month, the LRC, after it's updated, should be sending it to the RIAC members. Each RIAC has an identified area of focus that's selected by majority vote. And you'll see the spot for that up there. You'll also see it's a little bit colorful. It has red and blue on it. The red are questions that we want asked while you're thinking about each different category, like area focus. What's the overall area that the RIAC wants to impact? And then in blue is kind of like thought-provoking questions that will help you get to that answer. The emphasis here for the goal statement and objectives are that they're SMARTY. We want to make sure your goals and objectives are specific, measurable, attainable, realistic, they have a set time frame, and they're inclusive and equitable. We have a recorded action planning and SMARTY goals training, as well as a using data to develop and support the action plan that are available on the RIAC Learning Series channel. And we encourage you to watch those. It's a much deeper dive into the action plan. And then next, or right below that on the action plan, it's on our next slide. You'll see the second part. Next slide, Vanessa. There you go. So the first column is whether it's active or complete. So whatever activity that you have listed in that second column, if you're still working on it, it's going to say active. If it's already been completed, you're going to document that there. It'll list the person or agencies responsible, a target date for completion, desired outcome, which means if we complete this activity, what will be different, any data sources or resources used. And then in that current status next steps column, that'll be the date that it was reported to RIAC, a summary of whatever action was taken, and then list the next steps for that activity if there is one. So some of the common challenges that Vanessa and I have seen over the years, one is RIAC membership, being able to quickly identify who are mandated versus non-mandated members, and making sure that all of those are at the table monthly. Next is Robert's Rules of Order, and that ties back to who the membership is, making sure that it's voting members, whether mandated or non-mandated, that are making motions and voting. Screen sharing required documents. This can be a skill that's built over time. We just want to make sure that the RIACs are screen sharing that quorum tracker every month so that all the members can see whether they're a voting member, who the guests are, and they can also see if they need to identify an alternate from their agency. And then the action plan that we've talked about several times now, how we want that shared on the screen so that all the RIAC members have a visual in front of them about the work that's going on and what's needed. Voting in parent and youth reps. Vanessa shared the definition of each. There's also an application that's available online, or you can get from your local resource coordinator. If your RIAC ever needs help in deciding whether or not someone meets those criteria, Vanessa and I are always available to help with that. And then related to the parent and youth reps are connecting the parent and youth reps to those supporters that we talked about that are listed on the quorum tracker. This supports engagement and retention for your youth and parent reps. The next one, a challenge that we see is sharing meeting materials at least 1 week prior to the meeting. That it helps with member engagement and making sure that members come to the meeting prepared. And then as far as action planning, utilizing the plan during the RIAC meetings, allowing the RIAC members to drive the planning, using data to support or identify the need, aligning it with systemic care core values, making sure that it's community-based, youth and family-driven, and culturally and linguistically responsive. And then we want to make sure that what you're working on supports sustainable system change, not one and dones. And then on the evaluation section, there's a spot on the action plan for the evaluation plan as well as the evaluation findings. And that evaluation plan should be written in whatever you, however you hope to evaluate, should be written in from the very beginning. And then the findings, once you've completed your action plan, go back and plug in what you found out, what you accomplished.
Right. So some key takeaways from the presentation. So regional system of care needs and/or efforts as identified by the RIAC are the responsibility of the RIAC to address. So we want to make sure that also that our goals that we are selecting as a RIAC are sustainable, or that we are supporting sustainable system change that promotes better outcomes for Kentucky's children, youth, and or transition age youth with or risk of behavioral health needs in their families. That is our RIAC population of focus that we are working to target. Also, the work of the RIAC, again, is the responsibility of the members, all members. So it's important for all members to be present at each meeting. And then action plans, like Lee just talked about a second ago, they are essential to the work of the RIAC. They are always evolving, and therefore they should always be updated. And once updated, the RIAC members should always have the most current copy so that everybody's on the same page everybody has access to the same information. And then nothing should be implemented without a strategy for sustaining it. So a lot of times we encourage RIACs to apply for grants, and they are ideal for building the case and providing seed money to support the system changes, but the RIAC needs to be thinking about how they are going to sustain and maintain those initiatives when the funding is gone. All right, so as RIAC and SEAC administrators, Lee and I are available to do like we're doing right now and assist with RIAC orientation and or overviews. We can also assist with policy and procedures, whether that be the interpretation of the policies or assisting RIACs with adding to their policies and procedures for things that are relevant to their specific areas and or strategic plans. Also with member engagement and parent and youth retention, and then of course system of care trainings. We are also able to provide technical assistant coaching and support in whatever area that you need. If we cannot do it, we can definitely find someone who can support that. All right, so here are some additional resources. If you have any questions, please reach out to your local resource coordinator or LRC. Thanks for joining us today, and we'll see you soon.